Mostly, people don't want to live with HIV infect patient because they think that they can get infect from them. It's true, but it's not easy like that. HIV is spread by contact body fluid from HIV infect patient. Those body fluids are blood. Blood is the fluid from your body that contain white blood cell, red blood cell. White blood cell that is the cell that HIV virus will infect it. When the white blood cell have cell division, the HIV virus will division too. That way the HIV virus can spread to your body. Semen is the sexual fluid from male that contains sperm and virus too. Pre-seminal fluid is the sexual fluid that male will release before the semen. Rectal is the fluid from the anus. Vaginal fluid is the fluid from the vaginal. When the woman have sex with the man can get infected by vaginal fluid. Breast milk is milk from mother that give to the baby. It contains many immune system and also HIV virus. Some people think that HIV can spread by touch or live with them, but it's not true. This is the other way that HIV cannot spread to other people. HIV cannot spread into the air and water. HIV virus cannot spread by mosquito or insect because HIV virus cannot live in insect. HIV cannot spread by touching saliva, tear, and sweat from the patient. HIV cannot spread by shaking hand, hug, and drink water with the same glass.
HIV can spread through sexual contact with someone who has HIV, like having sex. Anal sex is the highest risk sexual behavior and vaginal sex is the second highest risk sexual behavior. Having many sex partners can increase your risk of getting HIV through sex. You can also get HIV by using the same needles, syringes, rinse water, or other equipment that were used by HIV patients because these equipment have contact with HIV patient blood, and blood is one of the body fluid that can spread HIV. HIV can be passed from mother to child during pregnancy and birth, and even if the child that was born from HIV-infected mother is not infected, the child could also get infected because of breastfeeding.
Some occupations, like doctors, can be also infected by HIV virus because they have to check the patient, but it's extremely rare because they protect themselves well. Finally is blood transfusion. When a doctor uses a needle to transfer blood to the patient, this is also extremely rare because the doctor have to check that their blood has no any HIV virus. But I think that they have to be careful is a needle that used to transfer blood because some needles is used by HIV patients.
Get tested and know your partner HIV status. Talk to your partner about HIV testing and get testing before you have sex. Use condoms. Use a condom every time you're having vaginal, anal, or oral sex. Don't inject drugs, but if you do, use only through drug injection equipment and water and never share your equipment with others. Limit your number of sexual partners. If you have more than one sexual partner, get tests for HIV regularly, get tests and treating for sexually transmitted infections or STIs, and insist that your partner do too. Having an STI can increase your risk of becoming infected with HIV. Have less risky sex. Oral sex is much less risky than anal or vaginal sex. Anal sex is the most risky type of sex for the spread of HIV. Talk to your healthcare provider about pre-exposure PrEP. PrEP is an HIV prevention method that involves taking an HIV medicine every day. PrEP is intended for people who don't have HIV but who are at high risk of sexually transmitted HIV infection. PrEP should always be combined with other prevention methods, including condom use.